Welcome to Mayo Clinic's ECG segment, Making Waves, continuing medical education podcast. Join us for a lively discussion on the latest and greatest in the field of electrocardiography. We'll discuss some of the exciting and innovative work happening at Mayo Clinic and beyond with the most brilliant minds in the space and provide valuable insights that can be directly applied to your practice. Welcome to Mayo Clinic's ECG segment, Making Waves. In this episode, we explore the exciting advancements in rhythm monitoring technology and the growing role of artificial intelligence, AI, in transforming how we detect and manage arrhythmias. Joining us is a cardiac electrophysiologist and expert in the field, someone that's been with us before, and he'll share insights into the latest innovations, the impact of AI on rhythm monitoring, along with the potential risks associated with these emerging technologies. So let me introduce you to our guest. Dr. Shiraz Kappa is a board-certified cardiologist and cardiac electrophysiologist specializing in management of complex arrhythmias. He completed medical school at the University of Medicine and Dentistry of New Jersey, followed by internal medicine training here at Mayo Clinic in Rochester, Minnesota, and fellowships in cardiology and cardiac electrophysiology at the University of Pennsylvania. Dr. Kappa focuses on complex cardiac and epicardial ablations and is deeply involved in clinical research, teaching, and the development of new technologies. He also leads several initiatives to enhance patient care delivery here within the Mayo Clinic's Heart Rhythm Services. Currently, Dr. Kappa serves as a section editor for Circulation, Arrhythmia, and Electrophysiology, and we're so glad to have him back with us today.
Thanks for having me.
Well, last time we spoke on the monitoring and what the options are out there. Now there's this big buzz on the new tech and how we're actually monitoring those. And I do want to refer our audience back to that episode where we talked about monitoring atrial arrhythmias and the options, and you helped us navigate us through that. But what are some of the recent advancements you've kind of seen in this, ever-growing field of rhythm monitoring?
Yeah, I would actually put some of the recent advancements in rhythm monitoring into probably four buckets. Bucket number one is miniaturization. It's actually getting ECGs acquired through form factors that are ever smaller and smaller. Whether they'll be like the injectable loop recorders sitting under the skin, which have gotten a lot smaller over the years, more and more battery life that allows them to do more extended monitoring. That could be devices that we use by our own hands to acquire our own ECGs that allow us to do it even through a credit card as opposed to, a full-out device. And these have been increasingly miniaturized. Number two, as I would say, being more and more patient-centric. And what I mean by that is, while original devices always had to be prescribed by a clinician, or implanted in a procedural room under sterile guidance, etc. What we're finding is injectable monitors can frankly be injected at the bedside without all of the prep work and everything else that is traditionally required with equivalent outcomes. And we're seeing devices that are available directly to patients even without a clinician's engagement to actually get themselves to start identifying, hey, is there an arrhythmia? And these are allowing for a much more patient-centric approach to rhythm monitoring. Number three, as I would say, comprehensiveness. So when we talk about comprehensiveness, most devices were really focused on either looking for normal rhythm or AFib. But more and more, we're starting to look at monitoring devices that look for other arrhythmias. Things like extra heartbeats called PVCs or premature ventricular contractions, or discriminating atrial flutter from atrial fibrillation, which become important to an electrophysiologist. And these become important and increasingly relevant to how we are able to interpret these monitors and how we're able to bin them when we're having to look them over and understanding, okay, what's relevant to evaluating a given patient. And number four, as I would say, is the informational management related to all this data that's coming through. And that gets into the artificial intelligence or AI portion of it. Namely, how well are we able to manage the amount of data coming in? Because you have to imagine, when we acquire a Holter on a given day in a given patient, that's 100,000 heartbeats in a day. And that's a lot of data for any individual to run through. So when you ask somebody, oh, what happened at 2:30 on that given day, that's not necessarily a simple question to answer, because that's what heartbeat number 76,429. And so that becomes highly relevant in terms of how quickly and how easily we are able to interrogate that data and understand where there are nuanceable differences or variations in that data stream.
Interesting. So you see those advancements in those four buckets that you mentioned, and we do get a lot of questions. I know Dr. Friedman, Dr. Noseworthy, Dr. Lopez have really led kind of this AI space, and I've been a fortunate clinician to benefit from, your work. It's really making a lot of waves in this area of healthcare. Um, in terms of rhythm monitoring, how do you see it changing? You mentioned some of the comprehensiveness. Is there anything else that, we're missing that you see as really groundbreaking in this space?
I would generally split AI for ECG monitoring into two areas. One is helping the clinical team manage data in a more kind of easy, efficient, impactful way. So that means things like interpreting a monitor, giving more accurate real-time interpretations of the data so there can be actionable interventions made without having to wait for maybe an expert cardiologist to give their more nuanced insight into it. So maybe at 2 a.m. you're able to actually intervene as opposed to waiting until 8 a.m. when the relevant expertise is available. So that's kind of on enhancing the interpretation, our current clinical model side. That's kind of what I was alluding to in terms of the management of the data deluge. But there is the other side of AI applications to ECGs and to all of the data we acquire in healthcare, which is what further insights could we ascertain from the ECG data that go above and beyond, what we normally look for, saying this is normal rhythm, this is AFib, this is PVCs, etc. And that's where we start getting into things like, can we get further insights into the data or from the data? Can we get insights into, it seems like this might be a day that you were low on potassium, or high in potassium based on the patient who might be in dialysis. Maybe they need to go for dialysis a day early. Or maybe it's a situation where they might have an impending issue with their heart function going down because of exposure to a new chemotherapy agent. And that's peeking out from their ECG information. They might point to the need for an ultrasound or echocardiogram. So that's kind of one of the big groundbreaking elements of how I feel AI's application to these data will actually improve outcomes even beyond our traditional thought process for the type of information we might acquire from an electrocardiogram.
So really giving us insights beyond, diagnostic, potentially more of even a screening approach or predictive approach of either impending doom or something that may be going awry. And something common that comes up for anyone we talk about, these AI or new technologies are the risks, the downsides, the regulatory components, the trust in these. What are you most concerned about when you see that, or is there anything that concerns you in this space?
Yeah, so there's a lot of things that I think are important to consider when we talk about any tool in medicine, when it's applied to patients, when it's newly applied to patients. Because, when we first create a tool, we try our best to validate that tool in a population. And we go through FDA approvals, research evaluations, et cetera. We say this in this population is accurate X% of the time. So we have a good sense of value, of accuracy, and of potential clinical impact. But the thing is, even diagnostic tools have risk of clinical harm. Like if we say, oh, this tool, we think because of it, you might have this more advanced disease issue, but you really don't. You create a lot of anxiety, you create a lot of additional testing and other issues related to it. So the application of a clinical tool, like any AI tool, just as a medical tool, to a patient, to an individual, is often has to be taken in the context of what the data surrounding it actually supports. And that's one big thing. And that's where us continuing to evaluate the utility, the accuracy, and the value is important, and the impact on cost of care as well. There's also the other side of sometimes there are risks or downsides we don't anticipate until we start using it on larger populations. For example, with pulse ox-based monitoring for heart rates, they found that skin color can have an impact on accuracy with traditional plethysmography, just because of differences in terms of light penetration of the tissue. And when that was borne out, that suggested, okay, well, maybe that approach might be more biased in certain individuals than other individuals, just from that basis. And it's purely from a pure science perspective and nothing to do with implicit bias. It's just frankly, tools work differently sometimes in different people. So because of that, we always have to think about were there nuances in the population that we might be underdiagnosing or overestimating risk in a given population based on certain elements of how that data was acquired, trained, or fed into a model to create something that was acting on that data.
Yeah, you bring up, we always hear about the bias in the data, knowing that that data really helps put out these predictions, and you can certainly see the potential downsides there. It's really exciting. I mean, this is a really growing field, and I'm really excited to, get your input to bring you back on and see, what's next for it, because I know you're always heavily involved in this space. Any final thoughts for our audience here before we close?
I mean, I think the biggest thought I would have regarding this is, while I know there's a lot of buzz around artificial intelligence and both fear as well as hope surrounding it, I would actually say that from a clinical research, et cetera, perspective, AI is frankly no different than frankly almost any other medical tool, medical metric, algorithm that we've ever used. We feed a system a lot of data, and we look for patterns in that data, and based on those patterns, we indicate, oh, this patient might have X versus Y. And it's not really anything, much more nuanced or complicated than that. So I wouldn't be scared of the use of AI in this space. It does require, however, the same amount of rigor and the same amount of evaluation to validate it as anything else. So I think that's kind of a key important aspect to think about. It's not that AI is necessarily replacing a physician or altering how a physician engages with you. It's really about how we can better make use of the data in a more actionable way.
Love it. Yeah. And something that, can pick up, as you mentioned, the patterns in a reproducible every single time type of way, which, we get tired and fatigued and certainly aren't perfect. Well, in today's episode, we explored the latest advancements in rhythm monitoring technology and the transformative role of artificial intelligence in detecting and managing arrhythmias. Dr. Kappa shared those four buckets that we heard about and the latest innovations in the space, the potential ways that it can help us with rhythm monitoring, as well as those risks involved with the rapidly evolving technologies. But as he mentioned at the end, don't be scared. It's something that could potentially have a lot of benefit for us. We just have, like every other tool, work through it to make sure it provides the intended thing that we want it to, the purpose. Now, Dr. Kappa, I really thank you for joining us, giving us a glimpse into the future of cardiac care. I know you continue to push the boundaries in this space and what's possible in electrophysiology. Thank you for coming on, and we hope to have you back again soon.
Thanks for having me.
Thank you for joining us today. We invite you to share your thoughts and suggestions about the podcast at cveducation.mayo.edu. Be sure to subscribe to a Mayo Clinic Cardiovascular CME podcast on your favorite platform, and tune in every other week to explore today's most pressing electrocardiography topics with your colleagues at Mayo Clinic.
This has been a Mayo Clinic podcast.